Senator Blackburn.
Thank you, Mr. Chairman, and thank you to each of you for taking your time to be here. And I appreciate so much that you all are willing to come and to talk with us about this. I'm going to pick up right where Senator Ernst left off. To me, it is absolutely inconceivable that we do not have a consistent standard of care, that there are abortion providers that are allowed to not have admitting privileges to hospitals. And when we talk about good care for women and children, we should want every physician to be able, if something goes wrong, to get that woman and get that baby to the hospital. And if these babies survive these botched abortions, we want to make certain that they are going to be able to get that care. And I think that it is such a tragedy that there is an absence of a federal standard that will specify how babies born alive are going to be treated after surviving an attempted abortion. And I tell you, in Tennessee, people want to see a federal standard, and they do not want their tax dollars funding abortions or used in the process of selling fetal remains. And before I came to the Senate, I chaired a House bipartisan select investigative panel, and we investigated some of the big abortion providers who were in the process of contracting and selling those parts. We issued 15 criminal referrals against some of the entities that were involved in doing that. And since that time, we have seen Planned Parenthood removed from several states' Medicaid programs. And we know there's still a lot of work to be done to protect women and these unborn babies and babies that survive these abortions. Dr. Perucci, let's go back in and pick up right where we were with Senator Ernst. Now, walk through, for the record, some of the procedures that are available when you have a baby that is born premature and is in a NICU. And what is, let's say, a 22, 24-week baby.
So at the edge of viability, first of all, before they're even handed off to us, the delivering doctor allows time for delayed cord clamping so that extra blood can get into that little one, so that we can start off kind of with the tank full, so to speak. Then when they're handed over to us, they immediately go into a warmer. There is both what we call a porta-warmer, so that's a warm underneath there. They're into a plastic bag because their skin is so immature that they get cold, fluids leak out. We can't keep enough volume into them. Once they are kind of slipped into this little bag to keep them as warm as possible, we're dealing with breathing. Most of the babies at that age might take a couple of gasps, but they're not able to breathe on their own, much less exchange oxygen and carbon dioxide effectively. So we place a tube that goes right to their lungs, and we immediately give them medicine, surfactant, that goes right into those lungs to start a process that allows us to back off on how much pressure we need to open up that fragile tissue.
So what you're laying out is that is the standard of care for a preemie. Ms. Stanek, do you have anything you want to add to that? I saw your head nodding.
Yeah, just that there are instances since the Born Alive Act was passed in 2002 that are accessible, they're on record, of babies being aborted alive at abortion clinics and allowed to die. You can go and hear a 911 call made in 2005. A mom named Angel had a late 22-week abortion because she was having family problems. And then the baby was born alive in the toilet. And when the baby was born alive, she went hysterical, called her friend who was with her, accompanying her, and her friend called 911. The paramedics, and that's the 911 call that's on YouTube. And the paramedics went to the door, and the clinic people said, "Oh, we just have a hysterical mom. There's nothing to see here," and they bought that and went away. And then in 2000,
What you're saying is there is a standard process for preemies, and there is a way these babies that survive abortion could have access to that process that would allow them to have a productive life and to have their chance at life. And that a federal standard would then give us the ability to override some of these state standards that prohibit the ability of emergency personnel to provide that care for that mother and for that newborn. I yield back.